Wonderful to be in the space with all of you. I'm so excited for today's event. My name is Allison Burgess. I use she and her pronouns, and I work here at the University of Toronto as the director of the Sexual and Gender Diversity Office. Welcome to today's event, Demystifying and Dispelling Myths about Gender-Affirming Care and Supports with Dr. Jordan Goodridge. Today's event is a collaboration between the Sexual and Gender Diversity Office and Temerity Faculty of Medicine's Office of Inclusion and Diversity, or OID. The Sexual and Gender Diversity Office is a tri-campus equity office under the umbrella of the Institutional Equity Office. The SGDO provides education, programming, resources on sexual and gender diversity for students, staff, faculty, and librarians. We're also a place that members of the university community can come to with concerns or complaints related to us LGBTQ plus discrimination. We will note that there will be live captioning of this event and that the live captions can be accessed through your Zoom menu by clicking on the More button or the three dots and then clicking the Show Subtitles or CC option. I also want to note that this talk will be recorded and that attendees will not be visible in the recording. We do plan to post the recording on our website at a future date. Today's event will take the form of a talk from our guest speaker, Dr. Jordan Goodridge, with the aim of dispelling myths and misinformation about gender-affirming care and supports in Ontario. There will be opportunities for a Q&A with our guest speaker. If you do have questions for Dr. Goodridge, we ask that you use the chat function or send them privately in a direct message to Carmen Kamen or Tamara Steinbach, who will be supporting with the chat today. They have event support on their Zoom names, so you can find them easily. We understand access to be a shared responsibility. If you have any access needs that could improve your experience of today's event, please let one of the event staff know. I will now turn it over to Saba Khan for our land acknowledgement.
Thank you, Allison, and thank you everyone for joining us at today's event. My name is Saba Khan. I use she, her pronouns, and I am the manager of the Office of Inclusion and Diversity at the Temerity Faculty of Medicine. We are thrilled to be collaborating with the SGDO and Dr. Goodridge to support this important event, which affirms Temerity Medicine's strategic commitment to excellence through equity. As we delve into this talk, I want to offer a land acknowledgement. We wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. As we reflect on this land and its original caretakers, we also recognize that colonial systems have long imposed rigid binaries and norms around gender, identity, and bodies, systems that have harmed and continue to harm both Indigenous and non-Indigenous two-spirit, trans, and gender-diverse people. In acknowledging this land, we affirm our responsibility to dismantle those colonial legacies. We commit to supporting two-spirit, trans, and gender-diverse communities and gender-affirming care as a vital part of decolonizing and healing. And we continue to uplift the knowledge and leadership of First Nations, Métis, and Inuit peoples in advancing Indigenous self-determination in healthcare.
Thank you so much, Saba. We are mindful of security concerns while using this platform. If there are any major disruptions that interrupt the host's ability to keep control of the Zoom platform, a member from the organizing team will ask everyone to log off immediately and the session will be adjourned. If there are any inappropriate verbal or written communications, individuals will be removed immediately. We want to remind everyone that this is a space of community and that we encourage respectful dialogue and that we hold one another accountable. We also want to highlight some supports available to students and employees at the University of Toronto. They're listed here on the slide and will be shared with you in the chat. If you are attending today's session and you're not from U of T, but you are in need of supports, please do message one of our event staff and we'll be happy to find you the appropriate resources and supports. Today's event is presented as a part of International Day Against Homophobia, Transphobia, and Biphobia, a global moment of solidarity and visibility for 2S LGBTQ plus individuals and communities, and is marked annually on May 17th to raise awareness about issues facing 2S LGBTQ plus people around the world. Today's event is also a part of U of T's annual Pride programming for the upcoming 2025 Pride Month. Today's event is the fourth and final event in the SGDO's new series, Gender Expansive Joy, that centers the creative and persistent joy of trans, non binary, two spirit, and gender expansive identities through knowing ourselves, our communities, and our history and ongoing legacies of resilience and resistance. The Gender Expansive Joy series launched in November with our first event in collaboration with Accessibility Services titled Gender Expansive Joy and Neurodivergence, and featured a panel discussion and about the intersections of gender expansive identity and expression and neurodivergence. The second event in February, titled Pink Light, a film screening and panel discussion, was in collaboration with the Faculty of Kinesiology and Physical Education, featured a short film by the same name, Pink Light, about a trans man and ex-pro hockey player. The event featured a panel discussion with filmmaker and former professional hockey player Harrison Brown, and first-time actor and goalie for the PWHL Toronto Scepters team, Carly CJ Jackson. In March, in collaboration with the Office of Indigenous Initiatives, we hosted our third event, which featured a talk by Benny Michaud, a member of the Métis Nation and director of the Center of Indigenous Support and Community Engagement at Carleton University. Benny spoke about the diverse gifts that Two-Spirit people carry and their work to reclaim their places in community and ceremonial circles. We have been so grateful to all of the contributions made by our guests over the last year in this series. But I want you to know that I am also personally so excited about today's event, in addition to all of the amazing sessions we've had before, because we've been hoping to have a conversation about this topic and with this very speaker in our programming for quite some time. In today's session, Dr. Goodridge will address myths and misinformation that circulate about gender affirming healthcare. He will do so by addressing the historical context of trans and gender diverse identities in healthcare, the realities of gender affirming healthcare in Ontario, how access to care works, and barriers to care faced by trans and gender diverse individuals. How individuals can provide inclusive and supportive learning and working environments for students, staff, faculty who are seeking gender affirming medical care, and what resources are needed. So, on that note, it is my great privilege to introduce Dr. Jordan Goodridge to you today. Jordan Goodridge is an assistant professor in the Department of Family and Community Medicine at Temerity Faculty of Medicine. He works as a family physician at multiple sites across the GTA and has provided focused to us LGBTQ plus healthcare for several years. He received his MD from Queen's University, completed his family medicine training at McMaster University, and did an enhanced skills year in HIV primary care through the University of Toronto. He has a strong interest in medical education, particularly in areas such as gender affirming care, HIV primary care, and sexual health care. Thank you so much, Dr. Goodridge, for joining us today.
Thank you so much, Allison, for having me and for the warm introduction. So yes, hi everyone. I hope you can see my slides. Okay. Oh wait, let me share them first, of course. There we go. I hope everyone can see my slides okay. So yeah, I don't have too much to add. I'm Jordan Goodridge. My pronouns are he, him. I'm a cisgender man. I'm a gay man who lives in Toronto and works at various sites in the GTA, as Allison introduced me. Um, I'm here, I hold a few different roles and wear a few different hats, one of which is a 2S LGBTQIA plus health team lead in the MD program at the University of Toronto. So this is really, one of my passion projects, one of the aspects of my work that I really love the most. And I'd say gender affirming care is, I love what I do in every aspect, but gender affirming care is probably the most kind of rewarding work that I do. And so I'm very happy to be here to talk about it today, to hopefully demystify, what gender affirming care means, how we can be gender affirming in our own kind of areas in which we work. dispelling some myths you may have heard or some misconceptions that circulate around trans and gender diverse folks, their identities, their transitions, and so forth. And really, leaving a lot of opportunity to answer any questions that you folks have based on, your own curiosities, your own work itself, things that you have always been curious, but haven't really felt like you've had the opportunity to ask an individual. So that's what I'm here for today. And I hope that by the end of the talk, you feel that we've covered these three main areas. And so again, I want to go over the historical context of trans and gender diverse identities, how that has changed, maybe over time with colonization, and how a number of these identities were reclaiming in different ways. We'll discuss the realities of gender affirming healthcare in Ontario, so that you can help support your students and the individuals you work with, your colleagues, et cetera, in terms of accessing the care that they deserve, that they need, that they benefit from. And we'll talk about how to provide inclusive and supportive learning and working environments for those who are seeking gender affirming medical care. And then in that, we'll talk about sort of what are some of the timelines, let's say, associated with gender affirming surgeries that individuals may seek out. What requirements may there be for time off or restrictions or things like that? And of course, again, I want to leave plenty of time for respectful questions throughout. So there's no such thing as a bad question. I just ask that you ask it in a respectful way that's mindful of, the community itself, the people on this Zoom chat, the Zoom call. Um, but yeah, as long as it's kind of asked from a place of curiosity and respect, then I'd be happy to answer it as we go. And I'll leave some time for pauses throughout. I know some presenters like to kind of leave all the time at the end, but I'll pause throughout the presentation, and hopefully it'll be more engaging and interactive a little bit that way. Before we go into it, I do want to cover some basics. And if you've been to some of the other gender expansive talks, or, depending on where you're coming from, you may already have a good appreciation or understanding of some of these, but you may not. We recognize that, this acronym 2SLGBTQIA+ can seem long, and sometimes, that itself needs to be demystified for people in terms of breaking it down, what it means. Because what we know is that those who use this umbrella, 2SLGBTQIA+, actually represent multiple diverse communities, right? Different sexual minority patients, gender minority patients, who all have unique kind of needs and desires and goals when it comes to their care, when it comes to various aspects of their lives. So I want to just make sure we're all on the same page in terms of language and terminology. And I want to also highlight that language and terminology evolves, right? And we know this not just in trans and gender diverse care, but in language in general. We recognize that, there have been names used historically by trans and gender diverse communities to describe their own identities, some of which has unfortunately been erased by colonization and westernization. And a number of these terms are being reclaimed, or new terms are being created to describe gender identities that have always been present. So as groups, as individuals, create better and better terminology to describe themselves, their identities, their internal sense of self and feelings, and some of these language pieces may evolve, right? So just keeping that in mind and always staying curious in order to stay kind of apprised of updates to terminology. So again, this is a basic concept. A number of you may already be aware of, and some of you may not, and that's okay. I really like this diagram called the genderbread person, because what it does is it helps to delineate different aspects of an individual's identity, different aspects of an individual's kind of sexual orientation, attraction, all of those things, and recognizing that they're separate, unique boxes, right? Or pieces of an individual's identity. So, of course, you can't infer someone's gender identity based on their sexual orientation. You can't assume either based on their sex assigned at birth. Um, and one of the things that I think a lot of people struggle with is this reality that you can't assume someone's gender identity by how they may choose to express their gender. So, gender expression is a term that we use to describe how an individual presents their gender to the world around them, to individuals around them. It can be through their actions, it can be through their clothing, their demeanor, it can be whether or not they wear nail polish, like myself, or if they wear makeup or what have you. And I hope you can recognize that these are really subjective things, right? Often culturally, society will kind of describe or define things that are assigned to different genders, but that's completely objective. There's a lot of criticism around that, understandably. Nonetheless, we recognize the society that we live in and that sometimes we do adopt some of these behaviors as a way of expressing our gender, right? But again, you can't assume one's gender identity based on their expression. So just because I painted my nails doesn't mean that I have a certain gender identity, right? The only way to know is to ask a person because their gender identity is an internal experience of how they define their own gender, right? What things they align with or don't align with. And again, that's different from attraction and that's different from an individual sex assigned at birth, which we usually use to denote what's decided on based on an individual's genitalia, for instance, or chromosomes or whatnot. So again, if you do have any questions about the basics, whether it be around sex, gender identity, gender expression, please do put it in the chat and I'll try to intermittently take a look at that. Here, I really like this diagram as well because it really highlights the fact that any of these things exist along a spectrum, right? So I think, unfortunately, in the past and still to this day, a lot of people will try to put people into boxes. You either fit in this or this. And we recognize that the beautiful thing about humanity is that we don't neatly always fit into one distinct box or another, right? There's a wide range of how an individual may identify their gender across the spectrum. And so there's more than just cis man, cis woman, trans woman. Of course, we know non-binary individuals, agender individuals, gender fluid individuals, right? People who may exist kind of anywhere alongside a spectrum of quote unquote womanness, manness. And we also recognize that there's natural variation within our population, within biology itself. Right. So the term intersex, for instance, recognizes that there are people whose sexual characteristics, be it genitalia, chromosomes, etc., don't necessarily always align with this binary notion of man and woman as a gender, right? So recognizing that intersex or differences in sexual development, we sometimes use as a term, um, highlights the variation that's actually naturally present amongst our populations worldwide. So keep that in mind. And then as we talk about specifically, gender diverse individuals, these are the terminology pieces that you should be kind of comfortable and aware of. Again, if you went to these talks before, and depending on your own experience, hopefully some of this does feel basic to you. But I recognize that, over time, we've probably adopted more terms in order to better describe different types of gender identity, right? So transgender is an umbrella term you've, of course, probably heard of. You've likely heard of trans men and trans women. And one thing that I want to highlight when it comes to updates in terminology is some of the older terms like female to male or male to female aren't really the preferred terms for the majority of individuals these days. Of course, anyone's allowed to use the terms that define their own identity, and we should be respectful of that. So there will be some people who still do align with these terms or prefer using female to male, male to female. But for the most part, these other terms in blue, trans masculine, trans man, non-binary, these are more so the preferred term that many individuals within these communities like to use. All right. The other thing I want to highlight is you, of course, cannot assume an individual's pronouns based on their gender identity. Okay, so the only way for you to know what pronouns an individual uses is to ask. And that's why I normalize introducing myself with my pronouns. Anytime I give a presentation, He, him is on my slides. Anytime I verbally introduce myself, be it to my students, be it to faculty, be it to my patients, I say aloud my pronouns are he, him, and that allows a kind of more welcoming, inviting, safe space for individuals to introduce their own pronouns. But again, unless you actually ask or unless they volunteer, you can't just assume these things. All right. So I don't see any messages in the chat about terminology, but maybe I'll give it 20 seconds just in case there is anything that anyone wants kind of clarified for them. And it doesn't have to be, of course, anything that I've mentioned so far. Right. Well, if anyone's still typing, that's okay. I'll keep my eye on the chat. If not, we'll move to the first major part of this presentation, which is talking about the historical context of trans and gender diverse identities. Really should have updated this to say not just in healthcare, but also actually in the legal system. Um, what we want to look at is kind of the historical context that our TGD individuals have, recognize how things have evolved over time, but also recognize that societal perceptions of trans and gender diverse individuals can take time to change and aren't independent of the context that they live in within healthcare, within our broader society, within the legal system. And so hopefully I can discuss with you how they link together a little bit. So thinking about trans and gender diverse individuals and identities throughout history, TGD individuals have always existed. So the first major myth I want to dispel is that being trans or gender diverse is a recent phenomenon or it's a Western phenomenon, right? In actuality, we know, at least for centuries, that trans and gender diverse individuals have existed. So we know, if you attended the last talk in March, where two-spirit identities were discussed in more detail, you'll recognize that there's actually a rich history of two-spirit individuals. And for those who aren't able to attend the talk and maybe aren't as familiar with the term of two-spirit, two-spirit is actually an umbrella term. It's exclusively reserved for some Indigenous people who identify with the term, which means if you're not Indigenous, you shouldn't use the term to describe your own identity. And what two-spirit encompasses is gender and sexuality and some other components of an individual's identity that can sometimes refer to the embodiment of a masculine and a feminine spirit, right? That's probably the most commonly used definition that I hear, but it's not the only significance or potential meaning of the term either. There's lots of different definitions and feelings about the term. So sometimes people who are two-spirit also hold specific cultural roles or specific spiritual roles within the communities. They're held to kind of a high regard and revered for that. Yeah, and they have their own kind of responsibilities in their communities. And again, two-spirit, it's an umbrella term. Different groups, different tribes may have used different terminology to describe identities. And then kind of, our English, I guess, term to kind of summarize a lot of these different identities ended up being two-spirit. So just recognizing that. There's also, outside of, North America, there's a lot of examples of gender diversity. So just highlighted a couple of others here, the Hijra communities and others that exist in South Asia. Um, this is often kind of one specific type of community or identity within what some groups in South Asia call the third gender, right? And so actually existence of this third gender has been found in Hindu holy texts from long, long, long ago. So recognizing that this has actually been present and actually celebrated and revered through South Asian history. Individuals who identify as being as a third gender sometimes do use the term trans or gender diverse to describe themselves, but sometimes not. And so again, the only way for you to know is actually to ask that individual who's in front of you, what does that mean to you, right? And ask in a respectful way, in an inviting and welcoming way, then that's totally appropriate, if relevant, of course, to kind of the support and care and whatnot that you're providing to this individual. And there's lots of other examples of gender diverse roles in other parts of the world, in Africa, in Polynesia, and beyond. So really, I just want to highlight this to dispel the first myth that, people think gender diversity is new or Western, right? What we recognize is that there have been more people maybe, let's say over the last decade or couple decades or whatnot, who have been accessing gender affirming care, but that's not because this is new, right? It's because with colonization, a lot of identities have been erased. The kind of, Western views on gender identity have been imposed on communities that actually already had much more diversity and had to suppress it for quite a number of years. I also want to talk when I talk about kind of the kind of historical context of trans and gender diverse individuals. I want to give you kind of a sense of a timeline of some key events and how that can lead to a delay in societal growth and understandings about trans and gender diverse folks. So to kind of compare it to same-sex individuals, or in other words, we you used to use the term homosexuality, individuals who are gay, lesbian, etc. Consensual sex between same-sex adults was only removed from the Criminal Code of Canada in 1969. So, just over 55 years ago, really not that long ago, but still much longer ago compared to some of the progress that we made when it came to gender diversity updates in terms of our legislation and whatnot, in the North American kind of more recent context. And then it was only in 1973 that homosexuality was no longer defined as a as a mental illness in the DSM, in the Diagnostic and Statistical Manual, which is the main resource kind of that we use within psychiatry to make diagnoses, right? So that wasn't very, very long ago. And you could imagine that having this label is very stigmatizing to individuals who did engage in same-sex interactions and coupling and relationships and so forth, right? And as you probably have recognized, society again takes many, many years afterwards to kind of advance and adopt their views. And there's still, of course, homophobia and discrimination even to this day. But I would say that we at least came a long way from where we have been in the past. Now, if you look at this timeline, I purposely tried to give you a scale to show you how long it was until gender identity, gender expression was actually recognized in Ontario in its human rights legislation. So 2012, only 13 years ago. A year after that, the DSM, again, the psychiatry resource that we tend to use, changed a label of a disorder from gender identity disorder to gender dysphoria. So you can imagine hearing gender identity disorder is probably quite stigmatizing. Assigning a medical diagnosis, a pathology to an individual who has a diverse gender identity, right, can be really unwelcoming, can make you feel kind of misunderstood, let's say, by healthcare providers and less likely to seek care and whatnot, right? So I'd say it was improvement changing from gender identity disorder to gender dysphoria, but there is still controversy around the use of this term gender dysphoria, right? Around the diagnosis that's associated with an individual's gender diversity. But at least in this context, in this use of the term, gender dysphoria more so means the distress, right? The dysphoria or the impairment that an individual may experience. A lot of the time it's described as a result of living in a transphobic world, right? Because if there's no transphobia in our society, we would be exclusively celebrating people who are trans and gender diverse, right? And ideally, that would reduce a lot of the dysphoria that individuals feel about their gender identity and the mismatch between gender identity and sex assigned at birth. But a lot of dysphoria actually results from the transphobic world, unfortunately, that we live in, the society that we're in. So keep that in mind, right? Some of the distress is mismatch between individuals, maybe organs or body parts, and that which they wish to have, but a lot of it really is the distress that arises, due to difficulties and barriers and challenges that these patients face in accessing care and accessing employment due to discrimination, right? And a lot of different hosts of factors that some of which I'll be able to talk about today. And then if we continue along the timeline, 2017 was when Canada, as a nation, recognizes gender identity and gender expression in its human right, in the human rights and the criminal code. And then only in 2022, excuse me, did the one of the diagnostic kind of, I guess, tools or resources that we use, the ICD, which is kind of a global resource, remove gender identity disorder and replaced it with gender incongruence. So just so that you know, gender incongruence means a mismatch between one's gender identity and their sex assigned at birth, right? And that's really more so the focus that we prefer to use if a diagnosis is needed when providing individuals trans and gender diverse kind of gender affirming care. Okay. So hopefully that paints a little bit of a picture, but the real big takeaway from here is that a lot of kind of the advancements, right, in terms of human rights legislation when it comes to trans and gender diverse folks has been recent. And as you folks have probably seen, these changes aren't permanent, right? Even when we make progress, unfortunately, some of that can be erased or some of that can be kind of pulled back on. And unfortunately, we move sometimes in the wrong direction. We move a little bit backwards, as we've seen in some of the provinces in Canada, right? And as we've seen when we look down at our neighbors down in the States, when it comes to protecting gender diverse individuals, their right to kind of, self-identify, to use the gender markers that they use, to use the pronouns that they use. So keep in mind access to care. All of these things can be really, unfortunately, um, kind of fragile and unfortunately sometimes can be reverted on. So there are a number of barriers to care, and I think this is just important to highlight because these are some barriers that, let's say, students who you work with might face when accessing some of the resources, within the institution itself or whatnot. Providers, individuals who work with people sometimes have a lack of knowledge or negative attitudes towards trans and gender diverse folks, right? And so by attending this talk, you're already bolstering your own knowledge, which is helping to address this barrier, right? By doing some self-reflection, hopefully you can also identify any attitudes you may have, any preconceived notions, because we all have been socialized by society to feel and believe certain things, even when we feel like we're completely immune to it. I have my own biases, right? Because I was socialized in the Canadian context. And only by reflecting and recognizing these can I actually dismantle some of my preconceived notions. Patients experience homophobia, transphobia, and other forms of discrimination in the healthcare system, in the educational system, right? And so, um, making sure that you recognize these, and I'll talk about how to address these barriers, but do you have policies in place that's anti-homophobia, anti-transphobia, a reporting system in case people experience discrimination based on their identities, right? What sorts of things do you have to demonstrate to people that this is a safe space where you won't tolerate these forms of discrimination? And so we'll talk about how to actually do that in your own kind of spaces in which you work. Of course, people can be reluctant to disclose their sexual orientation or gender identity for many, many, many different reasons, right? And so that's something that we can only do our best to attempt to open up to make it a safe space for people to disclose, but it's ultimately kind of on their own schedule when they're comfortable doing so. Sometimes it's if you have developed a bit of a rapport relationship with that individual as well. Um, oh, great. And I see a question. So I'll answer the question in the text. Please do, if you have any questions, please do type them in the chat because I have a spot where I'm going to pause for questions very soon. There's other factors that intersect with 2S LGBTQI plus identities as well, right? So ethnicity, education, income, location, beliefs. So this is the concept that actually Allison mentioned before, intersectionality, right? Is recognizing that there's a lot of different factors, social identities that make up any one of us. And these can intersect and interact in unique ways to lead to different forms of advantage in some settings, but also disadvantage in other ways, right? So again, we know that there's discrimination on the basis of gender identity, on sexual orientation. There may also be discrimination based on race, based on beliefs, ethnicity, based on religion. Um, And so you have to look at a person holistically to also identify what barriers they may have to accessing care with you, for instance, or accessing resources. And there's other system level barriers to accessing care. So one example in healthcare that I often teach kind of our students and talk about overcoming and addressing is the fact that cervical screening reports only capture female health cards. And so what that means is that, those who get a letter in the mail reminding them when they're due for their cervical screening, right? Those are the people who at the Ministry of Health have female associated with their health file. And so if that's updated by an individual, then they can sometimes be missed by these reports. So recognizing there's a lot of reasons why it may be challenging, uniquely so, for individuals who are trans and gender diverse in terms of accessing resources, right? And I also do want to talk about shifting paradigms in healthcare as well. So, healthcare overall has been moving towards what we call an informed consent model, right? So, historically, depending on when maybe you first did training and first started in your own roles, um, you may have been more aware of when, in order to access, let's say, gender affirming hormones or surgeries, people needed to go be assessed by a psychiatrist, right? Receive certain diagnoses and rule out other diagnoses. And make sure that they're quote unquote fit to, let's say, start certain or access certain types of gender affirming care. But these days, I think as we've evolved as a society, we're recognizing that this gatekeeping is unnecessary, right? And there's still, of course, times that we help individuals in their gender journey in terms of identifying and reflecting on their gender, how it may have changed over time, what their goals may be. Some individuals do benefit from speaking to others who are trans or gender diverse, or from speaking to people who are psychiatrists, clinical psychologists, social workers, etc., in terms of kind of navigating their own gender identity. And that's okay, but that's not always necessary. And actually, the majority of individuals who are trans and gender diverse don't tend to need that in order to access care. More so, it's something that can be offered alongside if it may be beneficial to the individual with whom you work. We also empower trans and gender diverse individuals in their own care, right? So what we're doing is we're working with them to identify what are their goals, right? What are their values? What do they perceive benefits to their care to be? What are drawbacks, right? These are bigger conversations we're having with patients. And so, sometimes it's a myth that we just automatically are putting everyone on hormones and surgeries and all of this without having discussions with them. But like anything that we would prescribe or provide, we just want individuals to be aware of the benefits, of the risks, of the drawback. But we see that there's risks of really not treating, right? And so that's why it's so important to think about how you can help patients, how you can help students with whom you work, et cetera, that's care, right? Be it at the Student Health and Wellness Center or their own family doctors elsewhere or wherever. We promote autonomy, we promote access, right? And this is the model that's supported by many health organizations, is this informed consent model, is having, sometimes multiple discussions with individuals to help identify what their goals are and how it can be met or might not be met by the treatments that we can offer. Um, Great. So that's actually a good question that I see in the chat. And this one I actually haven't looked at more recently. So legal question, and as a 2S LGBTQIA plus health team lead, I probably should know the answer. So it's the question is consensual anal intercourse still criminalized for those under the age of 18, or was it struck down in provinces? And that's a good question because I recall historically learning 18 being the cutoff for that, whereas consent, like the ability to consent to other forms of sex, including penile vaginal sex and whatnot, was 16. And so you could recognize that, there's a certain context and a certain kind of feeling around maybe there's some kind of homophobic stipulations that's kind of underlying why the age for consensual anal intercourse was higher at 18. I haven't looked into it more recently. Maybe when I give people, because I want to give people a bio break probably halfway through, I'll look into it and I'll actually see, because I think that is a great and important question. I have to admit, because really almost all of my patients are 18 and above, it's something that I haven't had to look into recently, but I'll get back to you on that. Again, if you do have any questions, please do put them in the chat. because I want this to be as applicable to you and your context as possible. And so I want to talk about
Hi,
the realities of,
Jordan.
oh, yeah.
So sorry, I want to, Dr. Goodridge, I want to interject. It's Allison speaking. We did
Yeah,
have a
thanks,
couple of
Elsa.
questions that have come in directly to us. So if it's okay, we
Oh,
could
actually now, yeah,
ask the,
let's do
yeah, would
that.
that be okay?
Yes, perfect.
Awesome. Sorry
Yes,
to
sir.
interrupt you. Um, uh, the one question that's come in was a question probably a little bit more for us, but I wanted to address it because it's come up in your talk. So it was a
Mhm,
question about somebody as a student who's navigating the university during a name change related to gender transition and navigating the sort of naming conventions at the university. And so the question is there a way for U of T name changes to make it easier and more centralized? The person talks about challenges with going through multiple touch points and encounters at U of T related to their name. I will say that U of T does have a name change policy in place for students. So for students who don't know that, students can change their name. Do not require legal name change to make that change. I will also say that there's current work happening right now to modify our name change, our name, way that we hold information in our student name uh, in the repository of student information. So for the person who wrote the question, I'd encourage you to reach out to the SGDO directly because we may be able to help. There are sometimes ways that people navigate the system that are clunkier, and there's ways that are smoother. So I'd encourage people to reach out to us, but also know for everyone that there's some processes in place that are happening that are hoping to improve that system. So I've sort of asked the question and answered for you, but we did have another question, and Scout was going to bring it forward because it was related to the section you just talked about, Dr. Goodrich.
great, thank you. Thanks, Scout.
Thank you. So we did have a question just building on what you were mentioning around terminology and gender dysphoria as being sort of a formal diagnosis that's used. And so someone asked that, to access certain aspects of gender-affirming care, particularly in Ontario, there's a requirement of a formal diagnosis of gender dysphoria.
Hmm.
And so, you kind of brought forward the way that diagnosis can sort of be a little bit erasing of the sort of systemic and structural contexts.
Hmm.
As the person asked, as healthcare practice evolves, how might we balance, the requirement of this formal diagnosis from the DSM with a focus on gender euphoria instead? And how do
Hmm.
you think we could support a more positive tone here at U of T around that?
Yeah, that is such a great question. And I think this shows, this is an example that shows how unfortunately change can often take time. Because actually, the most recent standards of care from this organization called WPATH, again, depending on the other talks you went to, you may recognize this. But for those who don't know, WPATH stands for the World Professional Association of Transgender Health. WPATH is really, who like I feel every country worldwide kind of looks to when it comes to what are the standards for providing care to trans and gender diverse individuals. That's kind of their purpose. Um, they, in their most recent update a few years back, recommended that when countries or provinces or cities or whatnot stipulate that a diagnosis is needed to access care, rather than using gender dysphoria, that gender incongruence is used. So in the past, old guidelines used to recommend gender dysphoria be used if a diagnosis is needed to access care. Unfortunately, in Ontario, in order to access gender affirming surgeries, they haven't updated accordingly, right? So it still is, using the outdated standards of care or guidelines, still requiring that a diagnosis of gender dysphoria needs to be met in order to have OHIP funded surgeries. So it's not to say that people can't access other surgeries, but as you could imagine, surgeries are not inexpensive. And if you have to pay out of pocket for these, especially with all the barriers to, barriers that individuals who are transgender diverse tend to face disproportionately, it's often not accessible if they're having to pay out of pocket. So really, for the most part, we view it like if it's OHIP funded, then it's maybe more accessible. Mm, there's still controversy even over gender incongruence. So I think it would be an improvement if we were to let's say, change it from gender dysphoria to requiring a diagnosis of gender incongruence. That's gender affirming surgeries. And I could anticipate it happening in a stepwise fashion, right? That once the dust settles from that and WPATH update, guidelines update and whatnot, we'd probably move more so to kind of looking for gender euphoria, to how can we just focus on the well-being, right? Rather than pathologizing, rather than saying there has to be, this negative diagnosis present in order to access this care and this support. Instead, just saying, especially as society hopefully evolves to a place where there's less discrimination, less systemic issues, how can we just evolve to a place of saying, let's be affirming of individuals and their own gender identities, right? I think we probably are still a little bit out from that, unfortunately, right? So I think taking it in a stepwise fashion, moving to gender incongruence, and at least those of us who are doing this work when it comes to things like gender affirming hormone therapies, right? We don't require gender dysphoria diagnosis anymore. But even in the medical system, right? Like I'm often teaching practicing physicians and nurse practitioners in the areas of trans and gender diverse and gender affirming care. Um, and most of the time they're staying on top of updates to guidelines and resources and societal views and all these things. But within medicine, sometimes it takes us some time to change our practices and evolve and adapt to, right? So some people are still using gender dysphoria as a required diagnosis when it shouldn't be. And so I would just say these things do take time to evolve and um, continuing to advocate for these things, I think is really important, right? When it comes to looking at, again, like what changes that have been already in legislation, what changes there are in terms of the ways that healthcare providers can advocate by lobbying the government, the NOHIP, and by writing guidelines, and by looking at ways to support those with whom we're working. I'll talk about some resources to connect folks with whom you're working to healthcare providers who are really gender affirming, who are really they have their finger on the pulse, who aren't the more outdated, just using gender dysphoria in order to justify providing care, but are a little bit more up to date in terms of at least using gender congruence more so, preferably, and even preferably looking at gender euphoria. But I think that's something that will likely take a little bit of time. Uh,
Um,
okay.
Sorry, Dr.
Yeah.
Goodridge, there is a sort of two-part piece just to play on that of
Mhm.
whether you can speak to like what you've seen across your peers as the reception to the terminology of gender incongruence in terms of, you're mentioning it can take some time. Are you seeing that folks who are offering this type of care are kind of, taking to that shift in framing or shift in, perspective
Mhm.
and do you see this being reflected in the reality of practice, i.e., will doctors still support patients whose desire for care is more motivated by gender euphoria in the current
Mhm.
system?
Yeah.
You spoke a little bit to that. I just wanted to offer the opportunity to respond more
Yeah.
specifically.
Definitely. Thank you. Yes, I would say so. So I'd say that particularly those who have been doing this work for some time, um, I think naturally, from hearing patients' stories and understanding their perspectives better, we've already kind of moved or shifted to that. So even before WPATH updated, because of course, like any guidelines, oftentimes what happens is there's a period of years where you hear murmurs of, oh, maybe we should be using gender incongruence. There have been other studies, case reports, lived experience, et cetera, that informs us. And so sometimes even these big guidelines take years to reflect some of the changes that maybe have already been starting within healthcare and within our society. So some of us had been using gender incongruence actually even before WPATH updated their guidelines. But certainly, I know a number of providers feel more comfortable implementing change once they can say there's this huge reputable resource that supports this work that I'm doing, right? And I understand that. I think as healthcare providers, we definitely want to do whatever we can to support our patients. We also don't want to cause harm. And sometimes there can be a concern, especially if you don't do this work as often, let's say, as I do. Mm, there may be more of a concern around harm. And then the more you do this work, the more you recognize that actually individuals can tell you really quite explicitly and really well about their gender identity, about their goals, about what they need. So some of us have already been using this label gender incongruence when necessary and focus more on gender euphoria. Because if you think about it, even though it's a diagnostic label, gender incongruence, again, just means a mismatch between an individual's gender identity and their sex assigned at birth, right? Which really is by definition individuals identifying as transgender or gender diverse, right? Is that there's not that necessarily perfect alignment, quote unquote, or fitting into one box or another. So I think it's been received much more positively. I'd say that my patients also much prefer gender incongruence rather than gender dysphoria. One of the reasons being is that gender incongruence, again, isn't actually a DSM diagnosis. And um, recognizing that those things that are in the psychiatry resource that are felt to be a mental health illness or disorder are going to often have more stigma and shame associated with them than those that aren't within this resource. So I would say it's quite well received. And thank you, Alcid, for answering the question in the chat. So Section 159 of the Criminal Code prohibits engaging anal intercourse except by a husband and a wife or two persons who are both 18 years or older, provided that the act is consensual. So it still looked like, at least from this resource, that hasn't been updated. That's surprising to me. Yeesh. But anyways, I'll take a look in the chat to see what other questions it's been. So reception to the term gender incongruence, I answered. There's some comments about students changing their name. Does it reflect the reality of practice? Yes, so I think that one I answered as well. Oh yes, and someone posted about, so I'll also put this in, like it is in my slides, um, is the service, the RHO, Rainbow Health Ontario, Service Provider Directory. And basically, it's people who have volunteered, have their names posted on this site, on this resource, who work, within the care field. It could be physicians, it could be nurses, nurse practitioners, it could be psychologists, social workers, various clinics and stuff. That have identified that they have a comfort or experience or knowledge in working with sexual and gender minority patients. And so I think that's a great resource to be aware of that I'll bring up later in this chat. Great. Um, so what I'll do is I'll continue on, and then maybe after this section, I'll allow a bio break for 5 minutes or so. So the realities of gender-affirming care in Ontario. So some of you folks may have questions about what gender-affirming care actually looks like here. And before we actually go into specifics, I want to give you an idea about the various types of care that we can help provide individuals. So, of course, there's a day-to-day bread and butter. I still see patients for the vaccines, for blood pressure checks, for diabetes management, for acute pain and other issues that they have. And that's the majority of the care that I do, right? I think there's this preconceived notion that the majority of the time that patients who are trans or gender diverse go to their physician is related to accessing hormones and surgeries, and that's absolutely not the case, right? That's just a component of the care that I provide. Um, there is different types of care that can support an individual in their gender identity. There's social care or social transitioning, sometimes we use the term. So when people use maybe pronouns that align better with their own identity, name change, things like that, we can absolutely support a patient in. And so even just using the name that a patient goes by and the pronouns that they use with them, that's gender affirming care. All right. It doesn't have to be the specific kind of, nitty gritty into the hormones and the surgery aspect by any means, right? There's legal updates and legal care support that you could provide. There's medical care support, of course, that I provide, things like hormones, surgeries, and therapy. And really, the goal is to improve health and well-being, right? So helping a patient reach gender euphoria, as we talked about, being affirmed in their identity, having their embodiment goals met, right? These are the things that we're really aiming to do with our patients, okay, with our individuals. And I like to highlight why this is so important. And there's so many reasons it's important. I think a lot of people, can really see a huge amount of benefit when I provide these statistics, which is why I do so. This isn't the only reason, though, we provide gender affirming care. We don't only do it to treat pathology or to reduce suicidality rates or reduce depression rates or all of these things, right? That we do see disproportionately affect trans and gender diverse individuals, right? There's a lot of positive effects otherwise that this leads to. But I think this does still really contextualize and I think is a really um, significant example of the life-saving nature of the care that we can provide our patients, and really the life-saving nature of the care you can provide students with whom you work in terms of accessing, right? Because what we see is that if we focus on those individuals who want, let's say, hormones or surgeries, we ignore this leftmost bar of those who are not planning, not interested in, let's say, accessing hormones or surgeries either at this time or at all. That's okay. But in those who are planning, who are interested, but have not begun hormones or surgeries, maybe there are barriers to accessing care. They don't have healthcare providers who feel comfortable doing so, so forth, so on and so forth. We know that there's unfortunately quite a high rate of past year suicidality. So this was a study called Transpulse Canada, took Canadian data within the last decade or so that surveyed individuals who are trans and gender diverse and found that in the last year of completing the survey, more than a quarter of trans and gender diverse individuals who were interested in transitioning with hormones or surgeries but had not been able to begin it, let's say due to barriers, had attempted suicide. And almost half of these individuals had seriously considered suicide, right? Largely felt to be in part due to not being able to live, in their comfortable body, in their gender identity. But what we see is that for those in comparison who are able to be in process of accessing hormones, or surgeries, or completed, there's a significant improvement in terms of suicidality rates. So the past year of attempted suicide rates went from 27% for those who are not able to access this care compared to 1% for those who felt that their transition was completed. And of course, that's subjective. What any one individual defines as completed may look different from another individual. But this is really just to highlight the life-saving nature that our treatments can provide individuals who may be interested in this. Okay, so keep that in mind. How access actually works in Ontario. So there's a lot of different types of gender affirming care, as I talked about. We talked about the informed consent model already for hormone therapy, for instance. Referrals for surgeries are generally covered by OHIP. And I'll talk about which ones are and aren't. But importantly, it's important to recognize that if you have students, let's say, who are coming from other provinces, their schemes for covering gender affirming surgeries might look quite different from ours in Ontario. So just be aware, and I'll show that to you in a little bit. Care often starts with family physicians or nurse practitioners. So we're the ones who are most commonly doing the surgical planning visits, for instance, right, or starting patients on hormones. Sometimes we refer to endocrinologists, but especially as there's been an increase in people who are accessing this care, I think it's absolutely appropriate for it to move more into kind of the realm of the family physician or nurse practitioner, who often knows the patients better as well. And this is absolutely work that can be done in this setting. It doesn't have to be viewed as specialized work, right? Unfortunately, no barriers do remain in availability and provider training. I'm very fortunate to be in Toronto, and I know, of course, people on this call are generally affiliated with U of T, but we certainly know that there's geographical barriers. Those who live in smaller towns often have fewer resources when it comes to accessing gender affirming care. And this is a really cool diagram that I found online. You can see the website below. That just highlights the differences in terms of what's actually publicly funded in Canada when it comes to gender affirming medical care, right? So each of these numbers and letters actually represents a different type of gender affirming care. And there's a little bit of a legend on the next slide that I'll show you. But I just want to highlight that in blue, it demonstrates things that are covered by OHIP or by whatever the provincial funding plan is. Yellow are things that aren't covered. A lot of things are partially covered or covered in some situations, as shown in green. And so if you compare, let's say, Saskatchewan to Ontario, you can see that there's huge disparities in terms of what's actually covered, right? Because this gets determined by province, right? If you look at somewhere like the Northwest Territories, right, it's a very much a case by case basis in terms of determining what is or isn't covered for a given individual. So just keep it in mind that, it's not a uniform system all across Canada. And this isn't something I want you to memorize, of course, or anything, but this is here for your reference if you, want to come back to this at any point. In Ontario, we're fortunate to have a lot of gender-affirming surgeries covered, but some are not, right? So you can see breast augmentation in B is sometimes covered, but there's stipulations in Ontario for it to be covered. So in Ontario, individuals who are trans feminine have to have been on hormones for a year with no breast growth on those hormones in order to access OHIP funded breast augmentation. Otherwise, if that's something that they want, they would have to pay out of pocket, and costs can be quite significant, of course, thousands and thousands of dollars. So being aware of this barrier, recognizing that that's the case right now in Ontario, it may evolve, it may change. Other things at least have partial coverage, right? Some things aren't covered at all. So, for instance, for trans masculine individuals who want chest tissue removed, the actual chest tissue removal called mastectomy, that is covered under OHIP. But a part of that surgery that sometimes surgeons offer called chest contouring, making sure the contour of the chest is quote unquote in a masculine presentation or a certain way with strategic liposuctioning, etc. That's actually not covered, and patients often have to save money to pay out of pocket. So some of the supports that we can provide individuals who are transitioning are actually financial in nature, right, in order to access that. So there's various barriers, wait times are often significant. And unlike other surgeries in Ontario, in order to actually get funding for the surgery, people who have done the surgical planning visits with a patient have to actually fill out a form, send it into the Ministry of Health, and then wait, often a period of months, in order to get confirmation that it's going to be covered. That's very different from, let's say, an individual who's getting their gallbladder removed, right? Where we can just sometimes refer directly to the surgeon. The surgeon has a billing code. We'll write that out and do the surgery, no big deal. Here, patients first have to find family doctors, nurse practitioners, social workers, etc., who can do the surgery planning visits with them. Depending on the surgery, they need one or two people who can see them, who assess them, who have the discussion with them. And then only after those visits can those individuals fill out a form, send it into the ministry, wait for funding, and then refer to a surgeon. So often the wait time from kind of patients presenting, requesting the surgery to actually getting the surgery, it's usually years out, right? So we really want to be as helpful when it comes to being supportive of patients around the time of surgery as possible. They've already reached so many barriers to actually getting the surgery itself. We don't want to create any additional ones for them. There's, of course, limited access in rural regions, right? A lot of the surgeons are concentrated in Toronto, in Ottawa, and in Montreal when it comes to gender affirming surgeries, especially depending on which one patients are looking for. I'll talk about some of the specific surgeries as well in a little bit. There's often provider discomfort or lack of knowledge, as I talked about before. And so that's something that we're trying to increase, right, in our communities through Involved Ontario, through our teachings and so forth. We still see, unfortunately, discrimination in healthcare settings, right, that we want to address, that we want to have policies against, and ways that individuals can actually file reports and concerns and have that mitigated and relieved. And then, of course, financial and systemic obstacles, as I started alluding to. Um, so there are these, and I also included more resources later on, but when it comes to navigating gender affirming support, um, in Ontario, there's a lot of clinics and resources, right? In both Ontario, we already talked about its service provider directory, you have T Health and Wellness. Safe for Six is actually, it was originally only kind of a sexual health clinic, and now it does provide gender affirming hormone care. And I think they're planning to start up, if they haven't already, started up doing the gender affirming surgery discussion with patients. So if there's difficulty finding a place to help your students in terms of accessing hormones or surgeries, you can look at places like Safe for Six. The 519 also has a gender-affirming care legal support clinic, right, for those patients who do need that. There's various community health centers that may or may not be taking patients at certain times that often do voice that they do gender-affirming care. Various trans-led organizations, peer networks, right? So there's actually in Toronto a lot of support for this. And keeping that in mind, supportive primary care is still ideal. And I think in my best case scenario world, every trans and gender diverse individual would be connected. I mean, every individual in general would be connected to a family physician, nurse practitioner, right? Primary care, a patient who knows, or sorry, a provider who knows them well over time, but particularly important for trans and gender diverse individuals who face specific unique barriers. And we'll talk about a few myths versus realities. So we already talked about the myth that being trans or gender diverse is a mental illness, a myth that I think unfortunately has been propagated in the past by labels like gender dysphoria and the DSM, right? And some misunderstandings around the use of those diagnostic labels. We do see a higher rate of mental health concerns in trans and gender diverse individuals, but that's likely due to what we call minority stress. So, what is minority stress? This is a model that we describe in medicine and healthcare elsewhere that helps to contextualize and understand the specific reasons behind health disparities amongst minority groups, and that includes gender minority groups. So, minority stress refers to the chronic and cumulative stress experienced by members of stigmatized minority groups due to experiences of prejudice and discrimination, expectations of rejection, right, which often results in the need for trans and gender diverse individuals to kind of regularly assess their environments around them and determine if they're safe, and the internalization of societal stigma against trans and gender diverse individuals, right? So these folks are faced with a lot of different obstacles and challenges. And this minority stress model explains why we can see some of the disparities that we do see when it comes to higher rates of mental and physical health outcomes, right? Higher levels of depression, anxiety, chronic disease, etc. It makes sense that if you're constantly confronted with these concerns, right? Am I safe walking down the street, in my environment, at my workplace? Might be discriminated against, may have unique challenges in accessing these resources. That plays a toll on an individual. That may lead to differences in terms of coping behaviors and things that can affect their mental and physical health. So that's important to recognize. And again, we see, unfortunately, a much higher rate of healthcare concerns, suicidality in individuals who are trans and gender diverse. And again, this isn't the only thing I want to highlight, but I think it's important for me to bring up because a lot of the myth around this is around something to do with the individual's identity. Whereas the mental health concerns that we see is actually a result of the discrimination, the barriers to care, the issues that transgender diverse individuals face by being in a society that really hasn't been welcoming and set up well for them. And so it's important for us to think about how we can address these issues and barriers when possible, right? Thinking about what supports an individual does have and exploring this with them. Who do they talk to about, their concerns, their well-being? Is it family? Is it friends? Right? A lot of individuals who are transgender diverse have chosen family or people that they're comfortable with. Um, do they have support systems in school or in their workplace environments? Are they aware of supportive spaces or groups? So at Sherborne, through Involve Ontario, there's a support group called Gender Journeys that anyone can be a part of. You don't have to be a patient at Sherborne Health. Um, that helps individuals who are at different points of their gender journey, in other words, right? Who may be interested or considering different forms of transitioning, let's say, or understanding themselves or what have you. These are supportive groups that you can connect your own students with whom you work to really benefit them and their well-being. Counseling online supports, right? There's a lot of different supports to keep in mind when appropriate for the individuals with whom you work, right? And of course, considering resources that are specific to these populations, right? Healthcare providers who maybe are understanding of the unique difficulties and disparities faced by this population. Another myth versus reality, right, is that trans and gender diverse and gender affirming care is experimental when we know it's backed by major medical bodies. We have good data showing that it reduces things like depression, anxiety, suicidality. And again, I still do criticize the fact that I think in healthcare we focus a bit too much on looking at a pathology and saying, look, we're fixing or we're helping with this pathology. Ideally, we focus also on that gender euphoria piece as well, right? And we do still see that long-term benefits in our own clinical practices and our own lived experience, that this care is life-saving, this care is an experimental. We know how much it's associated with improvement in terms of gender euphoria and people being affirmed in their body and their identities, right? Another myth that you probably have heard more and more, I feel like recently, and and probably in the news outlets and such, this idea that children are rushed into surgery or that they receive gender affirming care before they would be ready to make decisions about their own identity and whatnot. But that's not the case. No surgeries are done on minor, no gender affirming surgeries, right? Generally before puberty, we only talk to patients and their families, individuals about social transitioning, right? Things like using their preferred name, using the pronouns that they go by, thinking about how they dress, ways that they can feel affirmed in their gender. That's really the focus, right, prior to puberty. And then once puberty starts, we can consider something called puberty blockers. That pauses puberty, but if discontinued, puberty would result. So puberty blockers are actually largely reversible, right? There's this perception that we're doing irreversible changes, but for the most part, especially in the first years of puberty, we tend to just use puberty blockers, see if that kind of helps an individual feel affirmed in their body, before we consider any other hormones used, and only used, of course, with informed consent. So understanding that this person in front of us has the kind of maturity and understanding in order to make their own medical decisions, like they're able to do about other things like birth control or vaccinations or other things that people are able to kind of identify, whether they have the knowledge in order to actually kind of access these services, right? And have an informed consent discussion about. So before a quick bio break, any questions about gender affirming care in Ontario? I'm taking a look at the chat. Do, 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 do. So another point I've read is that because some practitioners require a gender dysphoria incongruence diagnosis, and especially because that diagnosis was traditionally required, trans and gender diverse individuals are more likely to have neurodivergence or mental health concerns identified and diagnosed over the course of their appointments, as opposed to non-trans and gender diverse individuals who are not actively attending appointments and remain undiagnosed. Great point and great question, right? So we do see higher rates of neurodivergence, and particularly in trans and gender diverse folks as well, right? And so that's a great point, is how much of that is because trans and gender diverse people have to come to us to access certain aspects of gender affirming care, that we end up doing more of an in-depth assessment than we might on other individuals, right? So some of it may be us picking it up more because we're actually seeing these individuals more. We're doing kind of more in-depth assessments and discussions and whatnot, right? It does look like there still is a true link, for instance, between neurodivergence and gender dysphoria, gender incongruence, right, or gender diversity. So it's really interesting, but it's hard to kind of weigh what percentage of that may be because we're just picking it up more, right? I see a question in terms of public coverage in Ontario and the rest of Canada. Did gender affirming care family member transition chose to go to Bangkok, Thailand to have it done? Yep. Surprised and happy to hear it was covered. Yeah, so can I talk about OHIP public coverage and how it works? Absolutely. So most of the time, patients will have surgeries done within Ontario, right? There's a certain form that we fill out in order to get care covered by OHIP, right? OHIP preferably would pay for it in Ontario. I say that because, we have had an increase in terms of providers who are offering certain types of gender affirming surgeries in Ontario, and the preferred location would be somewhere within the province. Um, some things like vaginoplasty, the creation of a vagina, patients often go outside of province, like to GRS Montreal. Now, in order to get funding outside of Canada, let's say to go to Bangkok, Thailand, in order to get a vaginoplasty, generally as healthcare providers on the form, we have to indicate that we're applying for this funding outside of country because it's not a surgery that patients can access in Canada. There's other ways we can get it accessed. Like we can say if there would be an undue delay in terms of accessing this surgery, let's say, that's another reason. But the most common reason that we can get it done in, let's say, Bangkok, Thailand, is because they do a type of vaginoplasty that's different than the ones done in Ontario and in Canada. So in Canada, we do what's called a penile inversion vaginoplasty. So the penile skin is actually what lines the vaginal cavity. We take that, we put that internally. We use some of the other tissues to create a vagina. So the scrotal skin and whatnot is often also used to line the vaginal cavity. Right? That's the procedure that's done in Canada. Whereas in Thailand, they often take what's called a colon graft, a piece of the colon, which is actually self-lubricating. And that's one of the reasons sometimes patients will prefer that and use that to construct the vagina. So that is the reason that we can have, let's say, vaginoplasty covered in Bangkok, is because it's actually a different type of surgery that's not offered in Canada. Otherwise, if it is offered in Canada, it's a lot more difficult. It's less likely that OHIP is going to cover it. Appreciate the reference to research studies from TransPulse. Can you provide a list of studies or a resource for further study? Example is a lit review on this. Yeah, I mean, I would, have to kind of go back to like my various resources and whatnot that I've referred to. But yeah, there is various studies kind of looking at the effects of gender affirming care, not just in the Canadian context, but most of the research is in the US and other parts of the world. Um, but yeah, maybe I can find time to find some of those studies for you. I see a direct message. Do, 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 do. Um, so yeah, maybe this one I'll leave for the end, just in terms of kind of clinics. So I would again refer to the Rainbow Ontario directory if you're looking for clinics to refer patients for gender affirming care. Say for six and whatnot, often sees people. Sherbourne Health Center, which is predominantly where I work at. Um, kind of has limited intake. Um, but if patients call on the first Wednesday of every month, ideally right at 9 o'clock, they can kind of sometimes get onto our list and become patients. So for those who are looking for where to refer patients, the Sherbourne Health Center is one location, although we are quite full and in demand. A question about, let's see, youth on accessing gender affirming care. How much does ageism come into play for those accessing gender affirming care later in life? Great question. Yes, that's actually an excellent question. So, um, I think especially those who are just starting gender affirming care early in their careers may have certain additional hesitations for providing hormones to those later in life, right? And a lot of that comes with the recognition that there are certain risks that are elevated by, let's say, the hormones that we use, right? So, estradiol, estrogen that's used in trans feminine gender affirming care may increase the risk of blood clots. And we know that individuals who are, let's say, an older age, especially if they have other risk factors, like they're smokers or anything like that, they have a further elevated risk, right? So there may be certain medical reasons that we're more concerned about the risks associated with hormones. That being said, that's why we're really pushing to an informed consent model, right? If the patient understands and appreciates that risk, they should be able to make the decision for themselves to say, I accept the slightly increased risk of clot, recognizing that living in an affirmed body has so many advantages to me that makes it worth it, right? So ageism still does happen, but I think healthcare providers more and more as we're moving to the informed consent model, as we move to it, I should say, um, have become more understanding of the real benefit and how that tends to outweigh the risks. Any other questions about accessing gender affirming care?
Hi, Dr. Goodridge, it's Scout. We did have one in the chat as well from someone,
Hmm.
not in the chat, sorry, that came to us about a shortage of injectable T or
Hmm.
testosterone across Ontario.
Yeah.
Recognizing that the scarcity of particular, forms of gender affirming care can be really stressful.
Hmm.
I'm wondering if you can speak to that or speak to any improvements in the supply chain or how that might be managed by pharmacies or
Hmm.
clinics that you know of.
Yeah.
Yeah.
Absolutely. Such a great question. You will absolutely see this. So in the 7 years I've been doing gender affirming care, um, I'm pretty sure every single year, at least one of testosterone enanthate or testosterone cypionate have gone on back order. So these are the names, don't commit them to memory, but these are the two injectable forms of testosterone that's widely available generally in Ontario. Okay, so it tends to be this one or this one. You don't have to remember the names. They're very similar. One's double the concentration of the other, but patients can go back and forth, right? They just inject, let's say, twice or half as much volume because the concentrations are different, but otherwise we basically treat them the same. So what often happens is that one will go on back order. There's a supply chain issue, and then we'll switch the patient to the other one temporarily. And then the other thing happens and vice versa. And we sometimes bounce back. Sometimes they're both available. Occasionally, rarely, neither is available. And that's when we sometimes get creative and switch patients onto another formulation. So by far, the most commonly accessed form of testosterone that's accessed is injectable. But there are other forms. So a transdermal, or basically a gel that's absorbed through the skin, and sometimes called androgel or testosterone gel, that's also an option. And a lot of the students you see may be 24 or under, right? Covered under OHIP plus, just so that you know, the injectable forms of testosterone, as well as the gel form, can all be covered under OHIP plus. It just takes the doctor writing in. So basically, they just complete a form to request that OHIP plus will cover it. And in my experience, it's never been rejected for trans and gender diverse patients. So that's something that you can actually tell the students with whom you work, is actually, hey, you can let your doctor know that if one goes on back order, you can go to the other, but if both injectable forms go on back order, you can be switched temporarily, or, if you like it, indefinitely, really, in theory, to, let's say, a transdermal, a gel form. Some providers don't even realize that's now also covered under OHIP Plus, because it was actually only over the course of the pandemic that they've expanded coverage to that. So yeah, I hope that was helpful. Hopefully that answered your question. And I see a question in the chat about a parent or caregiver support, parent or caregiver support must be so helpful to kids seeking gender-affirming care. Absolutely. Are there any supports or programs available to caregivers and families to help them be the best supports possible for their kids, especially to counter some of the fear-based misinformation that comes through various media outlets? Excellent question. Depending on where these individuals are at. So I would say always assessing either with the student with whom you're working, or if they were to bring in their parent and you can talk to them directly, that's probably even better. Or if they give consent for you to talk to the parent over the phone, you can get a sense of where they're at. Some parents, want to really be on board, but are just worried, they're anxious, they're scared of their child being in a transphobic world, right? And not being affirmed in their identity, or being discriminated against, or facing violence, right? Some parents don't understand trans and gender diverse identities, and how individuals' gender identity might differ from their sex assigned at birth, right? Some people may be transphobic in and of themselves. So like for any given individual or parent, their specific needs to help support their child can look so widely and vastly different. So the first step is assessing where they're at, what misinformation they may have been privy to, and they may believe, and how to actually address that misinformation. Is it as simple as providing some information about studies or resources? Because there are a lot of great resources out there. One of them, there's like a resource called like Families in Transition. Get it? Transition. And there's like a free online PDF that kind of talks about the basics of gender identity, what it involves, what social transitioning is, how some individuals will choose to actually medically transition, et cetera, et cetera. There's various support groups, either in person or online. PFLAG is, a commonly known one. There's some groups like through North Ontario and Sherborne. So um, I tend to recommend it kind of based on where that parent is and what they may benefit from as well. Oh, great. And I see in the chat too, the U of T Family Care Office. Oh, did a workshop on this topic recently. So there's a link there as well. Hopefully they'll offer again, but I'm sure they offered a lot of great resources to kind of help support that too. Oh, yes. And I say thank you. So someone put in the chat that resources was talking about the families in transition. That's one that I do like hear a lot of very positive feedback around. So maybe what we'll do is because we had such great questions come in, feel free to take your bio breaks kind of as I talk, but I can kind of continue on, and that way, we make sure to get everyone out on time. And I also want to leave as much time to answer the questions, the rich questions that you folks are asking as well. So the last part is about inclusive and supportive environments for those seeking gender affirming care. So how can we support those individuals who come to us who say, I need time off for surgery, or what might it actually look like when people are going through physical transition, due to hormones and being quote unquote visibly trans, and how can we support them in their safety as they're doing so, right? This is kind of what I want to get at, and hopefully some of the questions I can help answer that you may have. Of course, as a university, I think we matter so much in this really crucial part of an individual's life. Universities are places of growth, identity exploration, and support, right? So a lot of the time, people are moving away from home, right? This is the first time they're living outside of their familial household. Maybe they feel more free to explore and express their gender identity. So because of that, many students actually begin a form of transition during university, right? And so we can really do a lot to help support that. Faculty and staff may also seek care, right? So those around you may also benefit from some of this knowledge and what I'm kind of describing and discussing today. And institutional support really impacts the health, success, and well-being, right? We know that by reducing barriers, we help improve mental health outcomes, we help improve individuals' quality of life, level of functioning, and so we're going to also improve their kind of academic performance and all of these other things. We really want to help them be successful in as many aspects of their lives as possible, and this is just one of the ways that we can do it, right? Um, oh, great. And someone put in the chat the link to PFLAG. So that was one of the reasons that I mentioned. Thank you so much for doing that for those who are curious. Um, the reality of trans inclusion is not disruptive, right? We know there are many benefits to trans inclusion. We know that diversity, equity, inclusion benefits everyone. It provides us unique ways of seeing the world, of interacting, of critical thinking in unique and different ways than if we're all a monolith, right? And so providing gender affirming care can just benefit everyone. It reduces stress, improves academic performance, as I talked about, and of course creates respectful, safe learning environments, which is really, really key. When we think about how we can provide socially accountable care to the students with whom we work, we can break it up into three kind of categories. So the micro level of care or advocacy that we do is kind of the person in front of us, right? The student that we're seeing or interacting with one-on-one, right? And the environment in which we see them in. So, is it visibly a safe space? Do I have physical signs up that shows people that this is a safe space for them? How am I interacting? Am I using their pronouns and names? All of these things. There's the meso level of advocacy or accountability, where we look at the local community, right? We look at U of T as an institution. We look at the clinical and academic context in which our patients or our students or individuals are situated, right? And then the macro is kind of thinking about those legal changes, for instance, right, that have led to at least improvements in terms of, supporting individuals from a legal framework or under legislation and a human rights kind of framework, right? So looking at larger, broader society that we live in, right, in Ontario and Canada and so forth. And so think about those things when you're thinking about how can I help support patients, how or students with whom I'm working, right? I've already talked about a lot of these things. If you put up things like positive space stickers, it's important that your behaviors, your words reflect what those are, right? It's more damaging if you let someone put their guard down, if they see signs up that say this is a positive space and you actually don't affirm their gender identity, their pronouns and names they use, right? They want to be able to come in and trust, you, trust your word, trust that you're going to provide respect and care. You're going to keep maintain their privacy, their confidentiality, right? You're going to be inquisitive and you're going to continue to learn about how to best support them, right? That's cultural competence and culturally safe care. And we kind of already talked about anti-discrimination policy, staff training, things like that, right? So think about, do the forms that you use allow students to actually write down their gender identities, the names they go by, right? Instead of just checking off male and female, right? Here's an example of some clinical spaces, for instance, that have rainbow flags up and things that signal the patients, this is a safe space. Um, Thinking about brochures, resources that actually feature people from diverse identities, right? Sexual and gender minority patients, racial minority patients, etc., can be really, really helpful in affirming to individuals. All gender washrooms, of course, we know why that's so important. And so think about, if you don't already know how to, what can you take away from this talk? What can you ask me about? What resources can you use to make sure you can offer or refer patients for hormone therapy, right? Whether it be in the Student Health and Wellness Center, whether it be at Safer 6 at that clinic, or one of the other clinics that are available on the Rainbow Health Ontario directory, for instance. Now you know about these resources, so you can actually support individuals tangibly with that. Mental health support we talked about, privacy and affirming intake process we talked about, collaborating with external providers, right? I think there's a lot of ways that we can really mitigate and reduce barriers by having direct referral pathways, right? For individuals that are taking clients, and recognizing that this changes over time as providers practices may change and may be able to grow, and considering intersectionality, which, as I mentioned before, is the multiple ways that disadvantage can compound to affect an individual's life, right? So the important thing here is recognizing that you can't assume that all members of a sexual or gender minority group share similar experiences and needs. It's about working specifically with that person in front of you, identifying what those needs are, and kind of even just connecting them, to the first point of care resource that you can, that can help support the individual. And of course, we have people from the SGDO on the top here, who are very well equipped to help support the students with whom you see, in accessing some of the resources if you're unsure, right? All right. Supportive academic accommodations can look like a number of different things, right? So flexibility for appointments and recovery. I'll kind of talk about that a little bit in the context of gender-affirming care, our surgeries, confidential documentation changes. We talked about that, and someone put in the chat about how students can actually update their name, gender marker, et cetera, at U of T. Respectful communication privacy, of course, is crucial, is important, and access to leave if needed. So when it comes to gender affirming surgeries, just so you folks are kind of aware, medical leave is usually recommended for at least 2 weeks after gender affirming surgery. But there's a lot of different surgeries that are available, and still sometimes patients will hear questions being asked to them by providers like, oh, did you have the transition surgery? There's not just one surgery that we offer individuals, right? There's a lot of top or bottom surgeries that are available. Some of them, like removal of the testes, called an orchiectomy, or the removal of a uterus, which is called a hysterectomy, those have shorter recovery times, usually 2 weeks or longer. And depending on, the nature of their work or their program, right? If they're able to do some courses online, they may be able to return to class after a couple of weeks. Whereas some of the other more extensive surgeries, the creation of a vagina, the creation of a penis, in other words, vaginoplasty or phalloplasty, respectively, often requires 2 to 3 months or more off. And some of these surgeries, like phalloplasty, are often done in stages. So the first part of the procedure is done at one time point, then the patient is allowed to recover for 6 months until the second part of the surgery is done. They go back to the surgical center. So in actuality, it often requires a certain degree of planning. And so many patients with whom I work plan for these surgeries to occur over the summer months, but we recognize that there is you know, because there's such long wait times to actually access the surgeries, sometimes patients will want to actually get it done as fast as possible once they're able to, right? It still can take years to actually acquire. So they may choose to have these surgeries done while they're still in class. And so recognizing that and thinking about if you can get creative in helping support the individual through this, if possible. Um, it may require multiple surgeries I already talked about. And the other thing too is that these are rough kind of guidelines. So patients often see their family care providers or their surgeons after surgery. They have check-ins, they make sure they're feeling well, but issues and complications do sometimes arise. And sometimes that does necessitate a longer time off of school. So being flexible and understanding that may arise and having that as a backup plan. What would happen if, you know, you needed longer to recover? What would be the options for you? Thinking about that is really, really crucial. Um, oh, great. So I see some in the chat saying that they're a health plan administrator with the Graduate Students Union, and the health plan covers the gender-affirming care therapy. Okay, great. And provided their email. Wonderful. All right. So, you know, these are the things that we need. We need funding for staff and infrastructure. And I think, you know, it's great that we do have the SGVO and other groups at the University of Toronto. Peer-led support groups are important for our patients, policy review committees with people who have lived experience, right, to know whether these policies are adequately addressing the needs of the trans and gender diverse communities. And of course, accessible and affirming healthcare access points, which we talked about how to actually provide. So think about how you can support your trans and gender diverse folks, reviewing and revising policies, advocating for inclusive coverage, right? As we just mentioned, attending training and workshops as you're doing now, right? Is doing a whole lot to help you feel more prepared to provide care and resources to individuals with whom you work. And as best as you can, supporting trans-led initiatives and listening to the lived experiences of others. I think that's where I learned the most when it came to the trans and gender diverse healthcare that I provide my own patients in my practice. Right. So again, I want to leave lots of time if there are any last minute questions or anything I didn't cover that you wanted me to cover today. We have plenty of time. But to summarize, gender diversity is not at all new. Trans and gender diverse people have always existed, right, in our history and across various cultures, so both geographically and temporally. People from these communities may have unmet health needs due to various barriers of care. And in the university, we can do a whole lot to support individuals addressing these barriers of care and helping them to connect to the care that they'll benefit from to improve their overall health, well-being, and success in various aspects of life, right? We know gender-affirming care is evidence-based, we know it's life-saving, and we know we can do a whole lot of different things to help support those with whom we work. So as promised, you know, I provided some resources I went throughout. There's other resources I know people were talking about, you know, can you point to what evidence there is in research out there? So, you know, a good place is the WPATH Standards of Care version 8. Um, the thing is, it's not like there's just one guideline, you know, so for the person who typed it in the chat, like it's not like there's just one guideline or one study or whatever, right? But what I would say is as a place to start, somewhere like WPATH, right, where the whole globe looks to when it comes to standards of care for trans and gender diverse folks. That's a longer resource, but a great resource with specific chapters into different things like gender affirming hormone surgery, gender affirming hormone therapy, gender affirming surgeries, caring for trans and gender diverse youth and adolescents, et cetera, et cetera. So for anyone who is curious about going back to kind of those studies, the research that these guidelines were created based on, I would say start there. And then they have a ton of resources, thousands of resources actually, like research and evidence that they've used. There's Rainbow Health Ontario guidelines, the American Academy of Pediatrics, and the Canadian Medical Association. And there's a really great resource in 2023, I think it was, from the Pediatric Society, Canadian Pediatric Society. That was a position statement on supporting trans and gender diverse youth and adolescents. So I think that was really excellent and recommend you to take a look. And there's other resources like eGal Canada that has as well as Transcare BC that has various learning resources available. Yeah, lots and lots and lots. But if you're starting anywhere and if you're looking for specific, let's say, research, WPATH would be a good place to start. For those who are interested in accessing gender-affirming surgeries, Sherborne Health and Rainbow Health Ontario have put together these transition-related surgeries, aka gender-affirming surgeries summary sheets. So these you can actually provide individuals who are, let's say, considering gender-affirming surgeries and maybe, want to know a little bit about the basics in terms of what surgeries are available to them, what the intended results are, what risks and side effects there may be. Here is an example of one for vaginoplasty, the creation of a vagina, that talks about what it is, what you can expect from it, what alternatives there are. They're each about 4 pages. And they're great because, I use them with every patient that I see. I give them to my patients to actually review in between our appointments, and they usually come with things highlighted, underlined, circled, for me to talk to them in more depth about. And that's absolutely something that you can help provide them with if they voice interest in accessing these. And I've talked about the Rainbow Service Provider Directory a number of times, and someone put the link in the chat, but it is also here as well. And I believe I'll be sharing my slides. I think Allison did ask me whether I was comfortable with it, and I said yes, as far as I recall. So for the person who direct messaged and asked me if I'd be sharing my slide deck, yes, I believe I am. And then, yeah, here's lots of resources for those who are thinking about expanding their family, right? So parenting options, talking about things like adoption, surrogacy, conception, um, things like egg and sperm banking. There's lots and lots of different resources on Rainbow Ontario's website, above and beyond just the service provider directory, right? So you can see a list of different things that's just related to sexual and reproductive health for 2S LGBTQIA plus people, but there's tons more research as well on here. So I want to just make sure you're aware of that. And I do also want to put a little bit of a shout out to these trans and gender diverse health modules that I created in my position as the 2S LGBTQIA plus health team lead at the University of Toronto. So for those, especially if you yourself are feeling a little bit shaky on terms of language and terminology, things like history, social determinants of health, or you want more information, the first 2 modules here I think would be excellent for you. But as well as if you're working with other providers who could use more information, maybe also you're interacting with students, healthcare providers who maybe want to learn a little bit more about trans and gender diverse health and how to provide gender affirming care. So these are resources that are completely free that you can provide to them. There's also training courses through Rainbow Health Ontario. Right these days, there's actually quite a lot of new resources that are out and available for people to learn about this really crucial, important subject. So I do want to thank you for being here today. Thank you for your excellent questions, for the interactivity. Again, this is some of the most rewarding work that I do. I know we can do a lot when it comes to helping support trans and gender diverse folks, recognizing that they face so many barriers, unfortunately, to accessing care and gender affirming care specifically. But really, just by being here today, by showing interest, by asking questions, you're doing a lot, and it's really reassuring for me to see that so many people from U of T are interested in seeing how they can provide this support. So thank you so much. I'll see if there's any other questions in the chat.
Yes, we have a few questions. I don't know if you can speak to all of them exactly, but also I just want to say thank you so much. I hope we can have a virtual round of applause for you. Like very remarkable reflections, and I love the journey that you took us, through gender affirming care and supports, particularly in Canada. We don't hear as much about what's available in Canada, and I think it's really important. I love that you refer to the 3 levels of socially accountable care for us to consider, and that you noted that, gender affirmation and inclusion ultimately benefits everybody. And so, yeah, give it up for Dr. Jordan Goodridge. I did pop in earlier. My name is Scout Swartz. I use they, them pronouns, and I'm a program coordinator at the SGDO. I just do, before we get into a few more questions, want to highlight for folks some resources we have at U of T, because some questions have come in about that. So we're just gonna get those slides up around student access to gender affirming care at U of T, which can be accessed through any of the three health centers on campus, as well as the fact that at this time, hormones and hormone replacement therapy are covered in part by student healthcare plans through the student union extended benefit plans, but that folks should check in with their specific provider for that information. For employees, most staff benefits do cover hormones under the prescription drug coverage. And as of 2022, Green Shield coverage now includes a $10,000 lifetime coverage for non-unionized employees and employees who are members of USW. So that's pretty awesome because we did have folks asking about that. And if folks have questions about it, they can absolutely, contact the SGDO as well. So, I do want to get to some of the questions as well that came through to us. We only have a little bit of time. So I think one that was asked was about the trans pulse data and whether, given the rates of, suicidality and the more negative mental health reporting that we see, is a harm reduction framework useful in thinking about gender affirming care, and does taking that framework impact the urgency of providing these supports, or is that framework not helpful at all? Someone wanted to know about that.
Yeah, absolutely, I would say. So that's often one of the things when I'm teaching various healthcare providers about providing this care, I do actually highlight that, right? Because again, I think as healthcare providers, sometimes we are quite averse to taking risks. But I think it's important for us to recognize that there's huge risks of not treating, right, not providing gender-affirming hormones to individuals who would benefit from it, right? And that is a huge risk is the risk of mental health destabilization, of suicidality. So that's why I say gender affirming care is so often life-saving care. And honestly, compared to a lot of like the treatments that I do prescribe, especially in primary care, like what other treatments do I have that provide the, let's say, mortality benefit that gender affirming hormones or access to surgeries do? Really not a lot, nothing else that I can think of, right? So yes, for especially for a lot of people who are, I think, risk averse in the healthcare profession, I do like to describe it a little bit like a reduction approach. Because I recognize every person needs their own framework in order to kind of understand the benefits and become comfortable with doing this work. And over time, I think the more we do this work, the more we recognize obviously there's many more benefits than just reduction in suicidality, but that's still an extremely important measure, right? I don't want to disregard that measure, but I want to recognize that there is also, of course, the importance of helping a person attain gender euphoria separate from that. But yes, to answer your question, absolutely. I do still sometimes describe it in a bit of a harm reduction framework. That's totally appropriate.
Okay, we might have a time for one more question. And for any questions that did not get asked, you're welcome to reach out to the Sexual and Gender Diversity Office. We will share the contact information and we can get them to Dr. Goodridge as well, if needed. But I think you spoke a little bit about this, but I would be curious to know if you can share, what obviously gender affirmation service resources support, it can be quite heavy. What does bring you joy, whether that's in this work or beyond? I'd love you to speak to that.
Oh yeah. Oh, absolutely. I could talk about that forever, but I know we're limited in time, so I won't so much. But yeah, I am being honest and genuine. I say this is the most rewarding work I can do. Honestly, my biggest excitement and motivation, it's nice because as a family physician, I get to follow patients over time and seeing people be affirmed in their gender identity and their expression and the way that they want to meet their embodiment goals is so fascinating, so beautiful. For people who are cisgender, I try to describe it to them as like, imagine that you yourself might be so confident and affirmed in your own gender identity. I do confidently feel internally like a man. And if I was in a body that was assigned female at birth, I could have only fathom the amount of distress that I would have. But then thinking about that distress, I'd be relieved in terms of having the physical changes that I so welcome with my gender identity. Oh my gosh. And to think that I can only picture that, right? I've been able to hear so many people's unique stories and experiences. They've let me into such an intimate part of their lives often. I'm really grateful for people sharing their stories and their journeys with me in a way that they haven't sometimes with anybody else in their lives, right? So I think it's rewarding because I get insight into people in a deeper level than I thought would be imaginable when I went to medical school, to be honest. And then helping people reach their goals and how grateful people who are trans and gender diverse are. Honestly, sometimes just by having a provider who isn't going to, misgender them or who won't purposely put up barriers. And like that alone, we underestimate how far away that goes, right? I often focus when I talk about gender affirming care. A lot of people think about hormones and surgeries, but gender affirming care is all of those other things that unfortunately trans and gender diverse people don't experience in day-to-day life when they go to restaurants, right? Or when they go, to a job application or where they're out and about or whatever. So like how truly grateful transgender diverse folks are and like how I can see them blossom and become so affirmed in themselves and so much more confident in everything like that is beyond worth it, beyond my expectations when I came into medicine, more than I thought I was ever able to do. So that's really what keeps me going and keeps me passionate about this line of work.
That's amazing. Thank you for sharing that. And that's something we see at the SGDO as well. Like, we don't have like faculty, staff, health providers on this call. You don't have to know everything about a person's identity to offer
No.
them affirmation, and that can mean the world to students. And so really want to emphasize this is something we can all be doing. Don't have to be an incredible, service provider like Dr. Goodridge to do that.
No.
I am going to throw it back over to Allison just in the interest of time. But again, thank you so much, Dr. Goodridge. We will have to do this again because there's
Yes,
so many questions we
please.
didn't get to. So
Oh, I
thank
love
you.
that. Yes, please. I could talk about this forever. I love this work. Thank you so much, folks. And thank you all for your interest and your engagement. It's just so wonderful.
Awesome. So we will send it to Allison. Are you there, Allison?
I'm here. Thank you so much, Dr. Goodridge. It's not often that I find myself tearing up and feeling choked up at work, and I will do my best to get through our final session, but I just want to extend my personal and professional gratitude to you, the number of people who are messaging me privately, separately from the Zoom window, to thank me for, and all of our offices for putting this on, to thank me for what you've done, Jordan, is Dr. Goodridge. I go back and forth with your names, is tremendous. You have offered us something so extraordinary today, and I really feel such gratitude to you for your contributions. The way you elaborated with specificity on the complexity of accessing care in and outside of Ontario was incredible. So thank you very much for your contribution to these conversations about gender affirming care at U of T and in Ontario and beyond. Thank you very much from the bottom of my heart. A few things I want to say before folks sign off. Thank you so much to Saba Khan and Tamara Steinbach from the Temerity Office of Inclusion and Diversity for this partnership. Thank you so much to Scout Swartz and Carmen Kamen for making today happen. Thank you to our friends from AI Media for your support with live captioning. We will share a link to a feedback form in the chat. You can also access that on the slide when I show it to you on the screen. We will be sharing the link following the event in an email as well. Of course, your feedback is incredibly meaningful to us as we continue to think about the work and the work that we deliver and the services that we deliver to all of you. Before you all leave, let me tell you a few things that are coming up. As we mentioned, today's event is in part marking Pride, and June 1st marks the beginning of Pride Month in Toronto and at U of T. This will begin with on June 4th, a tri-campus event, the Progress flag raising at St. George. This happens at Varsity Stadium. At UTM, this happens at the Davis Building entrance at the UTM campus flagpole. And at UTSC, this happens at the campus flagpole at the Arts and Administration Building, all on June 4th at 12 o'clock noon. Following that event on June 6th, our colleagues at the Family Care Office, in collaboration with Queer EFT employees, Positive Space, and Heart House, are doing a Family Pride program for the PA Day that happens on June 6th. So that happens at Heart House 10 to 12. Reach out to Family Care Office to get registered. The UTSC Positive Space Committee is hosting an event called Illuminating History, Unveiling Local 2S LGBTQ plus movements on June 11th. So please sign up for that, a session delivered by the 519. And of course, our annual event, formerly U of T Pride Pub. This is your formal invitation to all of you to join us at the U of T Community Pride, June 12th, at 4 p.m. to 9 p.m. in the Heart House Quad. I'm thrilled to tell you that we have a band called Trash Panda Brass who will be performing, and we are anticipating a few other performance guests that we're just finalizing now, and we look forward to announcing shortly. Please join us. There will be delicious food, $10 barbecue, and other treats along the way, as well as some great programming at the event. Please join us on that day. It's always a really wonderful affair, and this is your official announcement that there will be no rain that day. So everyone send out the good weather vibes that are needed. The other campus event that I know is a big cherished event, or Display Your Pride, the annual event hosted by Positive Space, is happening on June 18th. Like last year, this year it's a photo contest. Video submissions are also welcome this year. Read everything you need to know on the uft.me/DYP2025 website and start planning your contributions for this year. At the end of the month, June 25th, we have a student program, painting your packs, tote bags for Pride, in collaboration with the Health and Wellness and Accessibility Services. All these programs and more can be found on the U of T Pride calendar. The link is on the screen and will be shared in the chat, and of course in the emails following today's session. Thank you again very much for spending your morning with us. I hope it was a session that where you learned something, where you got some resources. Of course, our offices are always available. Should you have any questions, follow-up inquiries, or otherwise, our information is on the slide here. The Temerity, on behalf of the Temerity OID and the SGDO, thank you very much for spending your morning with us. Wishing you all a wonderful, happy Pride. This brings our event to a close. Have a wonderful afternoon. Take care, everyone.